Thank you, Mr. Chairman and Ranking Member Bost, and I appreciate all of you being here today, especially you, Mr. Secretary, for joining us, for making the time to speak with us. And I know we're not always going to see eye to eye on funding priorities for the VA, but I hope we can work here together, as we do oftentimes on committee. And Chairman Takano, this is one of the most bipartisan committees I sit on, and all of us here want the best for those who've served our country. My father served for 28 years in the United States Army. I've seen what he had to go through to get help and health care after exposure to Agent Orange. I've been at the Ralph H. Johnson VA hospital to take my father to appointments there. I've been there when his best friend passed away after being sick and visiting them in the hospital. And so I commend everyone, especially the Ralph H. Johnson healthcare system in Charleston. It's the only 5-star rated hospital in the state for patient satisfaction. Their VA Community Living Center has also received a 5-star rating for an unheard of 11th quarter in a row. The Becker's Hospital Review recently recognized our VA as one of the top 54 hospitals in the South. And I know they're doing tremendous work with medical devices. They have a 3D printer there where they are not only saving taxpayer dollars, but providing just innovation with regards to medical devices. And so needless to say, the Ralph H. Johnson Hospital is doing a fantastic job serving our veterans locally and across the state, and given the resources that they have. They do, however, have a few challenges, and I appreciate your help working through a few of them at one of our top tier facilities. First, I know that the President's budget is proposing a 21% increase. That increase will ensure the department continues to provide as part of that increase, is the department ensuring that they are focused on physician-led care for our veterans?
Yes.
Excellent. As you might know, Charleston, South Carolina, Low Country as a whole is gotten very much more expensive to live in. A family of 3-bedroom apartment, if you're a family of 4, will cost you about $3,000 a month in rent. Housing costs have gone up 25 to 30% over the last year and a half. One of the next issues I hear about from folks at the VA is locality pay. And Charleston has a very high cost of living, but despite the high cost of living, locality pay is lumped into an all others pay category with rural cities, meaning they're not able to competitively pay doctors, nurses, technical staff with the rising costs of living. And last month, the committee held a hearing on healthcare workforce recruitment and challenges within the VA system, where I was able to at least briefly address this issue with those that were testifying with the Assistant Secretary of Human Resources Administration. Though I was advised that the GSA plays the primary role in establishing locality pay, the VA also plays a role in advocating for facilities increasing in locality pay. So I'd like to ask you today, what can I do on my end to get my VA workers better pay that is commensurate with the cost of living? And not only is it housing, but the cost to buy groceries has gone up significantly as well. The cost of living there is just very expensive, more so than it's ever been.
Yeah, I was in your facility in February. We talked at length about this issue. It's a challenge kind of across the facility there. There's a major challenge in other cities. I've just recently visited Salt Lake City, Burlington, Vermont. So,
but what can we be doing? I apologize, I only have a minute and a half left. What can we or need to be doing to ensure that we're getting them pay commensurate with the cost of living?
So I'm talking to GSA and to the rest of the government. There's a federal pay committee that sets locality pay, so we're working that issue.
Okay. And then another issue that I'd like to ask about stems from the Defense Health Agency's decision to relocate Beaufort Naval Hospital to the Beaufort Marine Corps Air Station. As I understand it, the VA clinic in Beaufort is now exploring alternative site locations. VA beneficiaries in both the 1st and the 6th Congressional District, which is Jim Clyburn's district, depend on this clinic being in the Beaufort area. And I request that representatives of our veteran community in Beaufort be included in these discussions and offerings. If one of the things that I've learned in my first 15 months in office is sometimes there's a gap in communication, whether it's federal, state, and local. Not only is it government entities that sometimes lack that communication, but also including those who are on the ground, stakeholders, those that will be most affected, and would, I think, need the opportunity to contribute to the overall, I think, conversation is essential. Any thoughts on that? Are you familiar with that particular site relocation?
I'm familiar with the site. I'm not familiar with the relocation process, but you asked for my commitment that local vets be involved in any decisions on that and discussions on that. I'll make sure that happens.
Thank you so much, Mr. Secretary. And I yield back.